So what's happened so far? Hopefully you have all received a letter last week. I'm going to make the assumption that you have because you've got the invite to the briefing. And so if you've had the letter, then you would have got the invite. Sorry, I just stumbled a bit because I think somebody's taken control of the presentation. Is that right? It's fine if you have, but just sorry. Sorry, Leslie, can you just confirm, have you and Amy taken control of it?
No, it's okay. You're back again.
Yeah, thank you. Okay. So you should have had a copy of your letter and a copy of our new structure chart, and then also the contact details for your new team. We have had some feedback about some people, some parents and carers felt that the letters were a bit generic and not very personal to their individual children. And just in terms of a way of an explanation for that, because it's come through quite a few times, these letters have gone out deliberately, not naming individual children due to issues of confidentiality. We do currently have in Nottinghamshire 6,291 children with education, health and care plans and 795 open assessments. So that meant that we had to get out around 7,000 letters to parents and carers, and we wanted to do that over a short period of time so that everybody was receiving them at more or less the same time. We did that. We started on Wednesday and we managed to get all of those letters out by the end of the day on Friday. But yes, so just some context in terms of why they didn't reference individual children's names, but we did try to make them individual in terms of them being from your new team manager and your new team. We've tried to respond to as many individual questions as we can as we've gone along. We have had, when the letters went out, we've had questions by email and phone call. We'll continue to try and do that as much as we possibly can. But as also say, if you think that you haven't had the correct information or you've got friends or people that you're in touch with that don't feel that they have, then please contact us on the team email address and we'll make sure that you get the information that you should have had or try and answer any of those questions. Next slide, please, Amy. We're not. Shall I carry on?
Yes, if you could, please.
Okay. So I was just going to provide some context. It's a bit okay, I haven't got the slides in front, but just some context in terms of why we are where we are in terms of the redesign. So I think probably most of you will be aware that we had an Ofsted inspection in January 23. That inspection told us that there were priority areas as a local area partnership, so health, education and social care, that we had to address urgently. Ofsted came back to visit us in July last year, July 2025, to do the monitoring inspection. And they told us that we were making effective progress against those priority areas. But we recognise really clearly that even though we had that outcome from the monitoring inspection, that there's still a lot more that we need to do and there's still a lot of improvement that needs to happen for you and your children and young people. So the redesign is a result of a piece of work over 12 months, about 12 to 15 months, which has included extensive consultation with staff and professionals across the system, so across education, health and social care. And also we've also had some input and expertise from some national independent SEND consultants. It's also in response to your voices and the voices of your children and young people. And that's come from over over those 3 years since the Ofsted inspection, we've heard that voice through complaints, appeals, tribunals, surveys, and pieces of co-production work, and just feedback that we've had over that period of time. It's taken a little bit longer than we would have liked, but it's been a really big piece of work. I think just those numbers that I've talked to you about indicates the size of the service, but we also felt it was just really important that we got it right, which we hope that we have. So I am really sorry about the slide deck. I don't know what's how. I just wonder whether, Amy and Leslie, whether it's easier just to stop sharing if you can, and I'll just talk through without the slide deck. For some, just before I move on, if you just try and make me a presenter, Amy, then that might help. Okay. So the vision and the principles behind the redesign, I just wanted to kind of touch on those with you. So what this is absolutely at the heart of why we have done this redesign piece of work is about we want to improve the experience of our service for you and for your children and your young people. And we believe from the feedback that we've had that how we will do that is we will improve our responsiveness in terms of when you get in touch with us, improve our communication, and that we'll do that through a relational approach and an improved, more positive relationships, both with you, your children, but also with the professionals who work in your local communities and support your children. So the design is about a localised approach, particularly for those children who have already got an education, health and care plan. So that's your children that we're talking about today. And also that we will have dedicated focused teams on assessments so that we can hopefully, well, not hopefully, we will improve on our timeliness and quality of our assessments by having workers who are focused just on assessments and not trying to juggle too many tasks, doing too many different things at one time. And then so that we can improve on the quality and the timeliness of our long-term casework and annual reviews. We've got we also have a dedicated county-wide EOTAS team. That's our children. Some of our children are educated other than at school. We recognise that those children aren't on roll at a school, so they don't have a school who is accountable for having an oversight of their education, health and care plan. And so we've got a dedicated team providing consistent approach and oversight for those children and young people. We've done a lot of work behind the scenes in terms of our systems and our processes to make them more effective and efficient. And that's also included improving innovation and use of digital software. And ultimately, what we've tried to do is create a more doable day job for our staff, because if their roles are more doable and they're more accessible, then they'll have more time and ability to be able to support you more effectively and more efficiently. So I do believe I now am able to share, but I think have you moved it on? Anyway, are we on the right slide now? Anyway, vision and principles. We are. Thank you. Okay. So I'm just going to talk. If you could move it on to the next slide, please. Or do you want me to share and then I can do it? There we go. Perfect. Thank you. I'm just going to talk just a little bit about the model and the different roles before we move on for the team to introduce themselves. So I guess this is a sort of simplified version of the structure, but I think what this new structure really gives us is much more clearer lines of accountability throughout the service. So I sit at the top of the service in terms of head of SEND, and ultimately I'm accountable for the children and young people in the teams. I report directly to Peter McConaughey, the Director for Education, Learning and Inclusion, and Peter reports directly into Anne Cole, who is our Director for Children's Services. Underneath me, we've got 3 service managers, Rob and Louise. So Louise is with us today, Louise Benson, and she'll talk to you in a second. So we've got Louise Benson and Rob Briggs are the service managers for the plan and review teams. So we've divided the plan and review teams into North and South. Louise is responsible for the South, so in her leadership are Broxtowe, Rushcliffe, Gedlin and Newark and Sherwood. Rob is responsible for the North, which is Ashfield, Mansfield and Bassetlaw. And then we've got a third service manager, Louise Wright, who is responsible for the EOTAS team, the assessment team and our SEND education pathway officers. For those of you who don't know, our SEND education pathway officers, we've increased the capacity of them. So there is now 1 in each district, but they're like our early help, early intervention workers. So they work with families who are not yet in the statutory process. They haven't had an assessment and they haven't got a plan, but they support them at that sort of earliest point of intervention. So each of those teams have a team manager, and underneath the team manager sit our EHCP practitioners and our assistant practitioners. So I'll focus on the plan and review teams, and if there's any other questions about any of the other teams, I'm happy to take those, but also those teams will be doing their own briefings, and all of those will be available on the local offer if people are interested in those moving forward. So we've got 7 plan and review teams. I've already talked about those, 1 in each of the districts. And what in each of those teams, like I said, we've got the EHCP practitioners who are the practitioners who are directly responsible for the delivery, the operational delivery of what's in a child's education, health and care plan. They'll build strong relationships with the schools and education settings, and the assistant practitioners who are in the team will support them to do that. So they'll take on tasks that are a bit more administrative, or maybe answering the phone, responding to emails, directing things into different places, to enable the practitioners to really work with families and with our education settings and other professionals. We have decided that we are going to adopt a slightly different model of case allocation and practice. So we know that most of our children and young people are doing really well at school. Their schools are really capable of delivering what's in their education, health and care plan. They have a good relationship with their parents and carers and with the child, and actually they don't really need any intervention from ourselves. Those children and young people are going to be allocated to their team. So those parents and carers probably have very little contact with us, but because they're allocated to the team, when they contact us, the team will be able to respond to their questions and queries and signpost them and get them the information that they need. We also recognise that there are lots of children and young people in our service that do need intervention and need additional support. So those children and young people will have an allocated practitioner for the time that they need it. So, for example, one of those times might be when children are going through a key transition, so moving from primary school to secondary school. Those children will have an allocated practitioner, but the practitioner, because they've got a smaller number of children that they're working with, will be able to really focus on giving those children and young people the support that they need when they need it. I realise that this model is different, and people have probably got a lot of questions about it, bit of uncertainty around it. And I guess what I really want to say is that if it really isn't working, and we get a lot of feedback that it's not the right model, we will review it and we will listen, and we'll take that on board. But we did a lot of work into this. We did a lot of unpicking of it, and we really felt that this is the best way, the most efficient and effective way of us managing our resources, but also really working with those children and young people and families that need us. So I think, like I say, I anticipate. I saw some hands go up and then I saw them come down. If you've got questions, please put them in the Q&A, rather than raising your hand, because I can't take your microphones off because of the settings that we've got. But if you put your question in the Q&A, then I will pick it up. So I'm going to stop talking. I'm going to hand over firstly to Louise Benson, the service manager, and whilst Louise and the team introduce themselves, I'm going to start looking through the Q&A, answer as many questions as I can as we go through, and then when we come back round to the end, I will there'll be some time and we'll try and maybe answer some of those questions verbally as well. But over to you, Louise. Thank you.
Thank you, Claire, and well done for getting through that, despite the best endeavours of the IT gremlins. The problem with Teams is, colleagues, I don't know if I know you, because there is a bit of a power imbalance. You can see us, but we can't see you. You can hear us, and we can't hear you. But within the constraints of that, thank you all for coming. And let me just echo a couple of points Claire has made about relational practice. It's an easy term to use, but what does it actually mean? It means trying to establish good and productive working relationships between us in the best interests of our children and young people. Because I don't know who you are, I don't know your background, I don't know your story, I don't know your journey. What I do know is that those journeys will have been very different, will be unique to you. And what we can't do is unwrite the past, but we can, I hope, move forward towards shaping a future which is focused relentlessly on outcomes for our children and young people. That, I think, is the common ground between us. That is what I am personally, and the service that I lead is committed to working towards. It will take time. We can't, as I say, undo or unlive the past. But this is a real opportunity, I think, to start slowly moving forward, I hope together, with a particular interest for those children who will have one, and that is the vast majority, about preparation for adulthood and looking for the opportunity to build good and productive adult lives. Thank you. Leslie, over to you.
Hi, I'm Leslie Holt. I'm the team manager for Rushcliffe. I've worked within the team for just nearly 3 years, and prior to that, I worked in a secondary school in Gedling for about 20 years. So quite a lot of school experience with SEND and working with parents. I've been working in Rushcliffe for the last nearly 3 years, so I know some of the parents that are probably on the call today, but we have a whole new Rushcliffe team, and we are really looking forward to trying to make sure that the experience for your children and for you is the best that it can be. So I'm just going to quickly introduce my team, and hopefully they can unmute themselves to be able to speak. So if we start with Kate, Kate Bradley, do you want to go next?
Hi everyone, my name's Kate Bradley. I have been working in Nottinghamshire for the last 20 years as a teacher and as a SENCO, and more recently as an EHC practitioner. So hopefully my experiences can contribute to helping other families within Nottinghamshire.
Thank you. Poppy.
Hello, I'm Poppy Willett-Kirk and I'm an EHCP practitioner. Prior to this role, I qualified as a teacher and worked in a special school for a few years. And then from there, I moved into the role of a youth development support worker, where I supported young people from the ages of 5 to 18 who had SEN need and were also EBD. So I have a lot of experience working with families and working one-to-one with young people, which I hope I can bring to this role.
Lovely. Thank you, Roxanne.
Hi, I'm Roxanne, originally from South Africa, but been recently EHC practitioner. Prior to this role, I was a primary school teacher for 10 years with various senior leadership roles. So it's interesting. I've always received and written EHCPs, but it's lovely to be on this side of the fence to kind of see how the whole process works. So yeah, look forward to working with you all.
Angela.
Yeah, hello. My name is Angela Ibuabwedi. I've been in SEN before we went into into EHCP. I'm one of the EHC practitioners with Nottingham now, and I started with the team in October. As I said, I've had over 20 years experience in SEN. Prior to that, I was a tutor in college. So yeah, that's my experience. I look forward to working with everybody.
Thank you. Ikra.
Hi, my name's Ikra Parvez. I'm an assistant EHCP practitioner. I've been in this role for around 2 years now, and previously I've worked in other healthcare sectors, so in pharmacy and caring for elderly as well. So I have a really big care related experience in my past, and I have worked with young children with special educational needs in the past as well. So I am looking forward to helping you guys in this new restructure, and always here if anybody needs any questions answering. So you can always ping us a message on our inbox.
And so that is the Rushcliffe team, and we are really looking forward to working in this new way and supporting you all.
Thank you, Leslie. Thank you. So I've been trying to answer questions. I've answered a few questions as we've gone through, but I'm just going to ask for Leslie and Louise's support on a couple of those before we finish. So one of the questions is Leslie, how do I know if I'm working with the team or if I have an allocated practitioner? And if it is a team, how do I request an allocated practitioner if I feel we need more help? So I think if you feel that you need more help, I can answer that bit, because you would use the duty inbox, which we would pick that up and then somebody would respond. But Leslie, I just come to you just in terms of those children in the team already who will have an allocated practitioner. How quickly are we letting people know, in terms of when will people know if that's the case from Rushcliffe?
We're looking at, by the end of the week, people being aware of who their allocated worker EHC practitioner is. So we're hoping to have been in touch with parents and let people know by the end of the week.
Thank you, Leslie. And then this one's for you, Louise. So somebody's emailed about their child is 20 and they've had a EHCP since they were 10 and are looking to go to college in September. So they're basically asking, what support do we give for a child who's 20 who still has an EHCP when they're through till they're 25?
Yes, I mean that's a long answer potentially, because it absolutely depends on the presenting needs and aspirations of the individual young person and where they are looking to attend or continue in education. Because the older our young people get, the sharper the focus and outcomes, and the more individual and bespoke the arrangements somehow have to be, I would very, very much like the answer of that question to email me personally. louise.benson@notcc.gov.uk, so I can give you the answer you deserve, which would take longer and be more specific than is appropriate for this forum.
Thank you, Louise. Thank you. And just in relation to that, there's another comment, just another parent whose young person is at college and has asked about basically post-16 experience, because clearly the new model, our teams are supporting children all age, but I think I'll let Louise talk as our post-16 expert of many years. We've worked really hard to make sure that there's post-16 experience in all of the teams, haven't we, Louise?
Yes, we have embedded it. So rather than having a standalone post-16 unit, we have spread that across the localities. The expertise has not gone. It is still there, and our job is to make sure that each and every practitioner understands the infrastructure and nature of post-16, which is a world I have occupied unashamedly for many years, which I hope I know well. But that expertise, as I say, is not lost, and you can still come and ask for advice. And even if the practitioner doesn't know, they know who to ask.
Thank you. So I think I've answered most. I was just mid answering another question, answering one other question, but I guess there's another one on there. I don't want to name people because out loud, but in relation to an individual child who's just who's mid review, comment waiting for the draft to be issued on the hub. Could I ask that parent to email Leslie directly with the name of your child, and then we'll look at that, because I think the question is, Leslie, whether they will be allocated a practitioner given the circumstances. So if you email Leslie with the name of your daughter, she can get back to you in terms of with a response. So I think we've had I think we've got time for one more question, I think, before we finished. What time did we start? It was 11:30, but we've got another briefing at 15:15. So I think we've just got time. So see whether I'm clear. Where does the commissioning body for EHC plans sit in the plan? Not sure I understand that question. Is this now regionalised or managed county-wide? I'm not sure whether I'm answering this question correctly, whoever that was, but I guess if you're talking about the issuing of the assessments, the responsibility, legal responsibility for writing assessments and publishing the EHCP plan still sits within this service. It sits within the statutory SEND service. It's just within a different team under myself. If that doesn't answer your question, then please come back to me, and I will try to answer it. Okay. So, thank you. Sorry, I'm just saying there's one more question. And then I'm stopping. There's one more question. It just says the question is asking about if there's a review in the next month, will it still be supported by a practitioner? So my answer to that is we can't attend all reviews. It's just not physically possible. And I think I kind of tried, that was what I was trying to illustrate. We've got over 6,000 children with plans. But in this new model, our vision is that our practitioners will work with our schools. So we'll meet with schools regularly. We'll look at annual reviews in advance, maybe the term before they're due to happen, and we'll agree with the schools which of those reviews we need to attend, given what might be happening for that child and young person at the time. So we will attend as many as we can where it's necessary, but we can't attend them all, I'm afraid, and we don't need to, because lots of schools are perfectly able to manage them themselves. Oh, the question about assessments was about the commissioning in with regards to additional funding. So the commissioning we do still have a separate commissioning team, but we have done and are continuing to do a lot of work around our commissioning processes because we recognise that they needed to improve. So we've done some work already in terms of that relationship and the processes for commissioning, which I hope parents will be able to experience, will feel better, but we're continuing to work on that because we recognise that there's still improvement that's needed as well. Okay. I think we will have to stop there. I'm really sorry because we've got to go to another briefing, which is starting in 5 minutes. I think, like I said, there's one further question that is in relation to individual children. If I could ask that parent who's just posted to contact Leslie directly with the names of your children, she'll follow that up for you.
Right.
Thank you very much, everybody.
Thank you very much.
And I really apologise for the technical issues and difficulties and challenges we had at the beginning. I'm so sorry. But hopefully you found that useful. And yeah, thank you.